The Joint Commission stated that because of breakdowns in patient education at discharge, patients and caregivers continue to receive conflicting information regarding recommendations, medications, and unclear instructions regarding follow-up care. Therefore, my proposed intervention is as follows. The first step in implementing a standardized process is to determine if the patient admission is even necessary. By doing this, the healthcare provider is able to identify patients who are most appropriate for admission and for discharge with outpatient follow-up. The decision to admit can be facilitated through the use of a risk stratification tool performed by the provider from the moment a patient presents with chest pain in the emergency room. The use of patient portals. This is the first component of Coleman's model mentioned above. It is used as a patient-centered health record, and once the patient is ready to be discharged from the hospital, the nurse who acts as a transition coach, along with the multidisciplinary team, will collaborate to develop a plan that would enhance patients' understanding during the discharge education process. The first stage of this plan would begin with the inclusion of a brief introduction to the patient portal technology with a return demonstration. This teaching would include information for tech support, setup of patient profiles, including correct demographic information, username and passwords, as well as navigational tips while on the portal. The second component of Coleman's model is follow-up of the patient. It includes informing the patient that they will be receiving a 24-hour post-discharge phone call, and it is important that verification of demographic information, such as telephone numbers or secondary contacts, are done at this stage so that the healthcare team has the availability and the ability to perform follow-up with the patient. Additionally, a cardiologist appointment will be set for follow-up post-hospitalization. Directions along with telephone number of the doctor's office and appointment time will be provided to the patient. Explanation that a contrast-enhanced stress echo will be scheduled and performed within 5 days of discharge based on the follow-up visit with a specialist. Enhanced knowledge of any new medication regimens and of the discharge plan is essential to the outcome of the patient. Therefore, the final component of this proposed intervention is focused on patient teaching and understanding of discharge instruction. The nurse, who acts as a transition coach, can assess health literacy, cultural competence, and an understanding of how patients and caregivers learn. Educational materials regarding new medications, red flags, and risk factors must be provided to the patient in a way that is user-friendly and easy to understand. Once the information is provided, it must be relayed to the nurse in the patient's own words. When a clear understanding of discharge instructions is received, a list of educational classes in the area will be presented. The patient will be required to attend 2 classes per month for 6 months that will enhance heart health. These classes will express the importance of adherence to medication regimens, dietary restrictions to improve overall heart health, and knowledge of red flag indicators that would require immediate attention.